thanks so much for being here. I've been doing a monthly free webinar for probably over a decade, but none has been more important or more exciting than this one. So I'm so glad you're here. I'm so glad that you get to meet the amazing people that you're seeing on the screen right now. And in case you didn't know, my name is Rita Wolfson. I am the founder of Financial Social Work. And we are launching our financial health and wellness professional community. So those who are on the screen, you can match up their names with their wonderful pictures here, and they will be talking to you in a little while and explaining all of the exciting things we have planned for the new members of our financial health and wellness professional community. So let's go ahead. Let me just double check and make sure we're recording. Yes, we are. Okay, so here we go. All right, commonly asked questions. Leah is here. She does all things tech. If you've never been with us before, we are so happy and lucky to have her with us. We don't share the slides, but you will receive the recording of today's webinar, and it will be posted on our website, our Facebook page, our YouTube channel in a day or so. If you have questions, you can type them into the question box, and we will answer as many as time permits. There are no CEs or certificates of attendance for this webinar, just a lot of exciting and new ways of really doing our work and improving our lives personally and professionally. I'm sure that Leah has a link in the chat box if you have any technical questions. We're in GoToWebinar. I always like to start with our financial social work affirmation because I think that it captures the 25 years I have spent creating financial social work. It goes, just for today, I will love myself enough to face my fears, practice self-acceptance, and embrace hope. Just for today, I will silence my inner critic, speak my truth, and make peace with myself and with my past. I will give myself permission to eliminate toxic people, beliefs, and behaviors from my life. And just for today, I will prepare for a better tomorrow by healing my relationship with my money and with myself today. Kind of sums up what financial social work is all about. So the physical ramifications of the more than 2.5 years of the pandemic, along with the supply chain problems, high inflation, growing food insecurity, and so many other 2022 financial challenges will forever be a part of our minds, our psyches, and our lives. So we just have 2 quick polls today. We're going to start off with this first one, and let me launch it. Okay. There we go. Let's see what you think. Okay. So about 50% of you have voted. Okay, we'll give it a few more seconds. And there's almost not a right or a wrong answer. I'm going to close the poll and share it with you right now. And you will see There certainly has always been financial uncertainty for some people more than for others, but the 65% of you that think that financial uncertainty is greater today than ever before, I would have to agree with you. And that would certainly be one of the reasons that we are where we are today and doing this program and introducing and launching our new and exciting community. So I was going to show you a video that I really, really like. And maybe I'll have to post that somewhere. But I decided that instead, since this report came out yesterday, it is totally just the latest information available to us. And it's not great. It's just not great because financial health in the United States declined for the first time in the 5-year history of them doing this research. And you can see here where some of the problems were. And here's a graph from the report that kind of brings it right into our backyard. And I do have that link there. And if you'd like, we could probably post that if any of you, or you can reach out to me if you'd like to see the report. You can see that they did take a deep dive into women's financial health and found that women have lower household incomes on average and report making career changes due to parenting responsibility at higher rates and are more likely to say that their current level of debt is unmanageable. And we're going to finish just with these statistics. I happen to love statistics, but I know not everyone's a fan of statistics. But here you can see that 1 in 3 Americans are either struggling or already experiencing a personal financial crisis, and half of all Americans are having difficulty paying their bills. Things aren't going well in this country. So it's time to do money differently. We have to do better. And I've always believed that we can. And that is always about change, because if you change nothing, nothing will change. And you're about to see that we here at the Center for Financial Social Work, including our fabulous advisors, we keep talking about, well, what's our role in that? What can we do to make things better? So let's begin by seeing how we got to this point, why people are struggling so much, and why there hasn't been more change. So we started 25 years ago with the word feminomics. And since I created that word, I decided I got to give it its definition. And I gave it the definition of the gender of money, because there is a very real gender of money, beginning with those first few numbers in this third square here. Women earn less, they live longer, they're often out of the workforce. And we just saw from yesterday's report how women are struggling more than most men. So gender and money, feminomics, and then in 2020, when COVID started, and I'm one of those people that doesn't think it's going away, and it certainly hasn't gone away. And with Black Lives Matter, it really seemed like more people recognized that financial problems and stress can be traumatic. They're here to stay. We need to do better in helping clients with their money. So that was feminomics. So we continue to say, what else can we do? And the certification was where we went with that. So 20 some years ago, and although she's definitely prettier than I am, that's supposed to be represent me shouting into the woods, financial social work, financial social work. We need financial social work. But it really didn't seem like a lot of people were listening. And it gave us here the chance to develop the certification. So just want you to know what financial social work is, because our advisors that you're going to hear shortly, they are all graduates, and they will all be leading the sessions that we have planned as part of our community. So financial social work is the intersection of politics, the economy, social work, economic, gender, and social justice. This is what we've been exploring, talking about, and addressing, because it is a behavioral model and it's heavily psychosocial. We look at the thoughts, feelings, attitudes, beliefs, values, and experiences that drive financial behavior. And we describe financial behavior as how we earn, spend, save, share, and borrow. And until and unless behavior changes, nothing changes. So the heart of my work is about improving the relationship we each have with our own money and the relationship we each have with ourselves. So it is a very interactive, reflective process. It's strength-based, and it makes a difference, which I believe is why we have graduates, certainly across the country and around the world. We have graduates in China and Canada, Africa, Japan, a lot of different places. Even though the money systems are different, I believe it's because of the behavioral component. So kept asking, what else can we do to help? What else can we do to help? Well, we added this monthly free webinar, and we've been doing them, as I said earlier, for over a decade. And all of the recorded sessions are on the Financial Social Work website. They're all topics that we believe are of interest to our students and graduates, and they are open to everyone. And not too long after that, I started talking about the relationship between money and mental health, which I think as a result of the pandemic has become clearer and clearer, more prominent, more obvious than it was 5 or 10 years ago. And that is because there is such a relationship, a really close relationship. When you have mental health problems, it can be difficult to pay attention to your finances. You may not be able to work. You may not be up to managing your money. Or when you have financial problems, they most often cause stress, anxiety, and all types of physical, mental, emotional, psychological, and social challenges. So we keep going. So 2.5 years ago, we did start our monthly Zoom group, and our advisory board, and those are the people who we'll be speaking to and that you're seeing on the screen. Our advisory board was born out of those Zoom groups, and it has been quite a journey. And I am so appreciative of these amazing people who are with us today. Okay, well, Why? Okay, if you press the right button, it will go the right way. We have on our website many free ebooks, essays, recordings, lots of free materials available to everyone. We have a partner program, and we will be rolling that out more in the coming days and weeks. And just an overview, if someone refers someone to the certification, the person doing the referral receives $50, and the person making the purchase receives a $50 discount. So that is on the website, and it will be more prominent in the coming days and weeks. So we have the partner program, and next month I will be in Washington, D.C. to receive an award. I've been named an NASW Pioneer for creating financial social work, and that is a great joy and a blessing to me. I love being able to do this work, but most of all, I continue to ask that question of what else can we do to help? And we decided that the financial health and wellness professional community was what we could do as our next step. And while it is at the top of this mountain, that doesn't mean that's the last new thing we'll be introducing. I don't think so. So now we know, while I was shouting into the woods and it didn't seem like anyone was listening, that we needed financial social work, this economy, with all of its many, many components, is stressing people out, making everyone anxious and nervous and worried. Obviously, there's more to be done. And again, how can we help? Well, here's our plan. We have created this community as our own gathering place where those of us who understand how relevant and important financial health and wellness are to overall health, to every part of our lives. We need a place. We need to be able to share and to learn and to talk together and move this work forward and be able to help clients more. And I just needed to share. I usually have this quote on our closing page, but I have something else there today. But I thought it was appropriate to share that yesterday I was clever, so I wanted to change the world. Mind you, I've not given up on changing the world financially, but the reality is today I am wise, so I am changing myself. And that's an important component about this professional community, because our goal is to help members improve their own personal financial futures, as well as to become healthier, better role models and coaches and therapists and counselors for your clients. So why did we create it? Because while no one wants to have financial problems, most people do. And while no one needs to know everything about money, everyone does need to know certain things about money. And because most people, many people, have a tendency to confuse their self-worth with their net worth. And we have to stop doing that. And so many people feel some degree of guilt or shame about financial choices. That's not helpful. And lots of people struggle to manage their money because they weren't taught how. These are also unacceptable. And so many people are wondering whether to take a second job, change jobs, join the great resignation, or to quietly quit. So much to think about these days. We know that of our thousands of graduates and so many other thousands of helping professionals, social workers, mental health workers, human service providers, we know we can all benefit by being able to meet, know, and process with others who have similar personal and professional experiences and challenges. We can benefit from sharing knowledge, hearing diverse perspectives, opinions, ideas, and receiving support, motivation, and inspiration. And we can certainly benefit from having at least one safe, non-judgmental place for financial advice, consultation, or mentorship. And these are all of the things we've included in this community. And because we have this community, because if we don't address clients' financial behavior, we aren't providing the most comprehensive, holistic, or best care possible. And we know that everyone has something to contribute as well as to gain from being a part of this community. And those benefits would be personal and professional. It is open, this community, to everyone and anyone who feels they can benefit from the many opportunities to learn, share, support, collaborate, network, and change their own lives as well as their clients' lives through active participation. So now we are very excited and proud to launch the community. And just in 2 more slides, our advisory board will be talking more details to you. So it is an inclusive membership organization providing all of the things that we've been talking about to social workers, mental health, and human service providers, and all other helping professionals. And we know that so many helping professionals are in less traditional settings than we might ordinarily consider financial settings, but could use all of these benefits. So what's included? First Friday, we talk about money at a lunch and learn, and those are at noon on the first Friday of the month. Third Thursday, monthly Zoom meeting. Each of these is 1 hour, and this one is at 2 o'clock in the afternoon, and we're going to touch on the details when our advisors take over now. And we have a quarterly mentorship meeting and a quarterly networking meetup. And we have quarterly trainings on integrating financial health and wellness in your client work. And we have discounts on our financial social work products. Altogether, there are 36 opportunities within the year to learn, share, support, collaborate, network, and change your own life and your clients' lives. And now it gives me great pleasure to introduce Claire Dubé, who makes such a contribution to our financial social work and our professional community. Claire, you're up.
Thank you. Welcome, everyone. So why today? Why are we talking about this today? Well, we're in the month of September, And September is National Self-Care Awareness Month and National Self-Improvement Month. So what better time than to September to be launching this community? Um, Rita had spelled out that there are 36 opportunities with this membership. And I want to say those are just direct opportunities, because truly there really is an unlimited amount of opportunities for being in a community. I mean, social workers and financial professionals, we need a collaborative community to thrive. And we just don't need to be doing it alone. We deserve a strong community of our colleagues that will uplift and support us. Courses are great, but they're simply just not enough. And it's really crucial to have ongoing support and mentorship that evolves with us and as we grow and also as our practices change. So this is one of the reasons that I find that this membership and community is so important to each of us. There's so many opportunities that are not just directly with our work, but outside of our work. And I want to use an example of what has happened to me with just being in this small community that we're now growing and introducing you to. In one of the monthly meetings, somebody was talking about in a small group, a business that they were working with. Somebody had contacted them and they put me in touch with them, and I was able to do a workshop for some employees. And I never would have had that opportunity had I not sat in and had this discussion with this group. And what made this unique was we are all working in the financial field, but we are all working differently. So my financial therapy practice will be different than Shay's financial social work practice, and will be different than LB's and Matt's and Keith's. So, there's this opportunity to collaborate and work together. And what we have seen just with this small group of us that you see here, we're just really excited to be able to do it in a much larger scale with each of you. And I personally am looking forward to that. And that's why I can't wait to host the first Fridays Let's Talk Money, because there's no other subject I like to talk about more than money. So I welcome you to join us and support each other and learn from each other and grow with each other. And I'd like to pass it on to my colleague, Shay, who will talk about our next program.
Well, thank you so much. Wow, I definitely could not have said that better. Okay, Miss Shay, take it away. Where's Miss Shay? Uh-oh.
I'm here.
Okay, good.
Okay. I was trying to unmute myself. Hello, everyone. Welcome. I'm Shay, and I think the first slide went by a little quickly, but I am a financial social worker as of 2019. That is when I got my certification, and what really compelled me to do so was, well, I guess in basic terms, I'm a social worker, and I also love talking about money, so it only made sense. But also, I was working at a nonprofit, and I was going into homes, working with families who were experiencing multiple struggles and barriers. And of course, a lot of times, especially with low income families, which those were the families that I was working with, a lot of times money is one of the sources of one of their barriers to success. And so that is what prompted me to get my certification. And I have enjoyed my time here and learning and being able to chat with other financial social workers and communicate with them. I think that's the best part of it. I have been attending Third Thursdays for the duration of the time that Third Thursdays have been around. So I am excited to be not only talking about this today, but also moving forward, being a part of continuing to facilitate those sessions. Like Rita said, these happen at 2 p.m. Eastern Standard Time. They are 1 hour and they are structured. We typically begin with a financial health and wellness professional community update, and then we move into a small lesson or case study that relates to financial social work, of course, and how to implement it. And then we break into small groups where we talk about the small lesson or the case study, answer questions, talk about different topics. And then we come back to the main group and we share what each of us learned in the small groups. And like I said, I've been attending these for what I guess I can say years now. You said
Yep.
2.5 years? Wow. So I've been attending these for a long time, and I normally don't miss them, and they are my favorite. So if you are, I'm excited to continue to be a part of that and for others to join us in this journey. And so I'm going to turn it over to LB now.
Thank you, Shay. And we love having you on those Thursdays. You always bring sunshine with you. Okay, so now I have to get us. This is LB. You want to tell people about yourself and then go ahead and talk about community networking, which was kind of your idea.
Absolutely. I'm so glad to be here. I have been a certified financial social worker since I got certified in 2020, and actually found financial social work with trying to learn how to navigate COVID with my clients. I was a medical social worker, working at outpatient teaching facilities, so working with pregnancy till death. So I had a very large scale of clients demographic. So got involved, started doing all of the things, meeting a bunch of people, networking, and I have met, we all, I guess could say, have met a lot of different people with a lot of different experiences and skill sets, knowledge, so many things. And so I'm so happy to be able to provide a space to be able to have an intentional hour of networking for everyone to come together to meet one another through our Thursdays and webinars. There's so much information, great information and knowledge that one part of this, a part of it that we were noticing that we needed was a place to network, because some of our conversations would get intertwined with what people are doing and what they've experienced, what they need help with and support in. And so, I mean, you have students implementing financial social work in maybe a dissertation, and then you have, you know, social work in a hospital trying to figure out, you know, medical bills. That just there's so much to learn about people, and this also gives you an idea of or that support to build this support system, but also knowing, oh, who can I go to for this specific thing that I need help with or an idea. So so to have this hour informally, which is great, there's no pressure to meet one another, socialize, people from all over the world, create your contacts, referrals, just having a multidisciplinary setting and being able to further your network, which is so important in the line of work that we do, knowing who to call, when to call. So yeah, so that's what I'll be doing with y'all. In addition, you'll see me in other places. Let's see, an hour, creating contacts, referrals. So that's me. That's what we'll be doing. I will pass it now to Keith. Thank you.
Thank you. And I want to say that we did networking at our 2-year anniversary a couple of months ago. And Ellie really felt so strongly, and everyone liked it so much. Usually at that third Thursday, we do a training or a meeting or something, but this was just a couple of breakouts where we could talk about who we are, what we do, and what we need. And so that's how this piece came into being. Thank you, LB. And now one of our favorites, Keith. You want to introduce yourself and then tell people about what you've been doing. You've been doing this for a while, for sure.
Yeah, absolutely. Thank you. Thank you, Rita. So, of course, my name is Keith Davis, and currently I actually work as a housing counselor as well as financial counselor in Greater Cleveland, serving, close to over 300 families, providing them with different strategies and helping them assist some of the different financial issues that they deal with. But how I've been utilizing financial social work as a whole is that Rita says this phrase quite often, but a lot of times we're trying to shift the behavior from hopeless to hopeful. And during the time me finding out about financial social work, it actually took a few conversations from Rita herself.
Yes, it did. Yes, it did. Wonderful conversations, Keith.
Wonderful conversations. And through those conversations, I was able to understand really the big need of financial social work, especially today, as people face trauma, anxiety, stress, and oftentimes it's related to the social anxiety and barriers that they face, all wrapped into those money issues, that relationship directly with money. And for that time period, I began to really use a lot of the methodologies of working with individuals to go past those social behaviors that they had, really helping them to accomplish some of the goals and milestones that they set out to achieve. And utilizing financial social work, I was able to achieve that. Now, one of the things that I wanted to talk a little bit more about is, of course, our mentorship committee. And what is our mentorship committee? Well, specifically, it's utilized to support individuals and attendees with some of the general questions that they may have, maybe even interests and needs. But what it does do is that it allows individuals to have an opportunity to learn more about financial wellness and learn more about some of the different things that they're dealing with, maybe with some of their different cases, but also have an opportunity really to have a great conversation with professionals and individuals. And generally what happens through that support is that they're able to accomplish their goals. They're able to take that networking piece and move forward with some of that interaction that's much needed as they begin to prepare themselves for the work that's ahead. Now, one of the things that I wanted to share was just a brief, let's say, expression from someone who previously I met with through the mentorship committee. And he had this to say after he completed his certification. He wanted to send me an email about it. He said, I wanted to add that I just finished having a rewarding conversation with Mr. Keith Davis. Put Mr. Keith Davis here, by the way, whom I met in my first monthly Zoom meeting, sharing my thoughts, insights, and feelings of accomplishments having completed the coursework with him. Since he had shared that he was available to be supported in the process, I availed myself of his knowledge and care to make my experience feel like I could share. I look forward to beginning this great adventure. And so just like most of you who are listening, we look forward to really assisting you with this adventure of helping people achieve their goals, helping them improve their relationship with money and providing that support. But, of course, the one thing that's going to be needed is that time. So we have so many different opportunities to benefit from. Mentorship is one thing, but as you've noted, there are many other opportunities to be able to, attend. And, through that networking, through that sharing and being open, as you're beginning to hear, there are many advantages to doing so. So we want to continue to evolve the work. We want to continue to be supportive in that work as well. And, continue to help those families and those individuals that we meet with on a daily basis. So with that said, at this time, we're going to move over to Matt. I'm going to kindly hand it over to him, and he has more great information to share.
Hi, everyone. So I'm Matt Schwartz. It's nice to meet all of you. I'm a certified financial social worker. I got certified in 2020, really right before the pandemic hit. So excellent timing, all things considered. And I was originally working as a licensed, as a social worker, as a mental health provider at a community behavioral healthcare clinic. And I brought financial social work to our community behavioral healthcare clinic and said, hey, this is what I want to do here. And they said, can we bill insurance for it? Because that's always the biggest question in a community behavioral healthcare clinic. We have to keep the lights on. We can't give things away for free, and our patients don't have the means to pay for extras. And so we found out, hey, we could. Financial social work is a billable intervention because it's evidence-informed practice that's informed by a lot of evidence-based practices. When we look at the trans-theoretical model of behavioral change, when we look at mindfulness, we look at the transformative model of change, all of those things are evidence-based. And when we put them all together for financial social work, it becomes an evidence-informed practice. And as we publish more and more on financial social work, it's going to be a fully evidence-based practice. And so we started seeing patients and we built out an entire program, and not a single insurance auditor was like, you can't do this. So we kept on doing it more. And then when I moved into private practice and I said, hey, I'm resigning, my agency said, no, you're not. And so they, we had someone apply for the position to get trained and coached to become a financial social worker, and she just passed her exam. And so the agency is keeping it going because we recognize the importance of financial social work on our patients' lives. And we're an agency with 700 different clinicians, over 7,000 patients serving Western New York. And so if we can do it not only at our community behavioral healthcare clinic, I'm doing it in private practice. And so I look forward to working with all of you as part of sort of, I guess, the advocates, the instructional section, right? To teach everyone how you can really integrate financial social work into your practice, whether it's at a community behavioral healthcare clinic, whether it's in private practice. What's the roadmap to being able to bill for these kinds of services? How do we justify it? How do we take the necessary case notes? What's different? What adaptations do we need to make in community practice and in private practice from a clinical perspective? So I'm looking forward to working with all of you. First, you're going to see me at all of the other events anyway, but certainly I'm looking forward to bringing some robust training to our group so that way we can really take financial social work to our colleagues into the next level, because we have to get paid for what we do, and our clients are having money problems, and that becomes problematic, and yet we have to keep the lights on. So I'm going to work with everyone to hopefully teach you how to keep the lights on and how to provide these services to those who need them most.
Thank you, Matt. And thank you, Keith. I can't remember, you handed it off if I thanked you. And I know, we all know that you've helped a lot of people in those mentoring sessions. And Matt, I just want to point out to everyone, this is not exclusively for financial social work students or graduates. This community is open to everyone who feels it can benefit. What you're hearing these are established, exceptional graduates and we've been working for over 2 years to create this community that we're inviting you to. So at this point, I think Matt turns it back to me and I finish up. It's fine. We're going to have, I think, a little time for Q&A. So if you have any questions, go ahead and put them in the question box. The membership does include exclusive discounts for members, and they're healthy, helpful discounts. So that's included. And here we have the bottom line that everyone wants to know about. So an annual membership for all 36 personal and professional development sessions is $99, but our introductory offer for the next 2 weeks is $79 for the first year. And that means that each of those sessions is less than $3. So it's very affordable. So we have a lot of additional resources. This is our newsletter where we bring you timely articles. We curate what we think would be, or what I hope we know would be of interest to our members. And these are the next 2 upcoming free webinars. A month from now, we'll do money and mental health self-care strategies for the holiday. And then in November, we'll do the high cost of being poor. And we have another great webinar lined up for December that we haven't started promoting yet. Somebody has some noisy background. Okay, it just stopped. So we said that we would be giving away 10 financial health and wellness professional community membership. And we're going to do that in 1 minute. This is our second and last poll. So we will, or I will, launch it and try and get some feedback from all of you on what you got from this webinar. It's always so interesting. Our attendees are always so wonderful about participating. So almost 50% of you have voted, and we will see. We will share. I'll go ahead and close that. Almost 70% of you voted, and I will share the results with you. And I'm glad that you all feel that you benefited from attending today. I know how valuable all of our time is. Okay, we're going to hide that. And now we will finish up with the names of our 10 winners. And what you need to know is that we will be reaching out to the winners to tell you how to access this 1 year free membership. So I hope we have some questions because we saved some time to answer them, and you can ask them to any of us. Leah, do we have any questions?
Yes, we have, not many, but we have. Leslie asking, we develop and present workshops and programs, many of which seems to mirror one's financial health and wellness professional community is producing. Can we utilize your programs for ourselves to use? Is there a cost?
I'm not sure that I understand the question completely, but if you want to clarify it, go ahead. There's my email, rita@financialsocialwork.com. If you email me, we could either, talk about this via email, or I can give you a link to schedule a call with me. Any other questions that maybe we have a better answer for?
Not at this time. We don't have any.
Okay. Well, does anybody here, any of our advisory board, have anything else to add before we end this webinar? Feel free.
I'll add, you had the information on each of us. So if you want to reach out personally to us, I can speak for myself. I think the rest of the advisors as well. If there's any questions that you have that you want to take offline, please feel free to reach out because we're here to answer questions and support.
Oh, thanks a lot, Claire. That was great. By the way, everybody, underneath the discount code, you can see the link. Leah, maybe you could just put it in the chat box to learn more and to join the community. Who else? Anybody else? Anything else we forgot to say, gang?
Just that since this is for everyone, if you have, an HR or director of a nonprofit who would be, keen to learn, definitely send them this way, because they may not become a financial social worker, but they should certainly know the work that we're all doing.
I decided to call this health and wellness community because it's, financial problems and stress, anxiety, trauma, they impact every area of our lives. And we didn't want this to be exclusively for our students and graduates, though we think that we do a really great job, and these are perfect examples, this advisory board. But we know that a lot of people need a lot more training and support and help and guidance, and just don't have somewhere to go for it because it isn't really, so many organizations still aren't recognizing the importance of talking about money. Clients need a safe, non-judgmental space to really learn. We don't even talk about it. It's going on 2023. I'm not going to rush the rest of the year away, even though the Christmas decorations are already out. We're still not talking about it. We still have major problems that we as professionals, along with our clients, are going to have to deal with. Keith, go ahead.
No, I was only going to mention, of course, what you already mentioned, but just kind of reiterate something that's been synonymous with this webinar that we've talked about. We talked about community, we've talked about sharing, we've talked about networking. And specifically this industry, specifically with this work, there are a few opportunities to network, to talk to other individuals who professionally are going through the same types of challenges, casework or just private clients that they're working with. So this is a great opportunity to be heard, to collaborate, to network with individuals. And it's the perfect time period, especially with everything that's going on, those numbers and statistics that you provided. They only continue to increase, especially with everything that's going on directly within the world. So for us today, it's just a matter of us looking to take advantage of what's being provided.
I think that is a perfect note to end on, Keith. Thank you. That was great. Thank you to our advisory board. Thank you to all of our attendees for showing up today. And you actually have a few more minutes before you have to get on to your next client or anything else that is waiting for you. Thanks, everybody. We'll be back here next month talking about the holidays and how to reduce stress and practice self-care. Bye-bye.